very warm welcome to everyone. And we have got a great journey from 1978 to 79 till now, almost 4 decades, 42, 43 years that CBR has proved, and it has evolved, it has changed. Many experiments have taken place over the years, and we have seen adaptations on CBR approaches, but it has proved that it is one of the most cost effective, most efficient ways of reaching out to masses of people with disabilities who otherwise would have not been reached. So that is a proven fact. Today, with all of us, if you see on the participant list, there's a galaxy of professionals who have been involved in CBR as implementers, as planners, as designers, and who have contributed to the community-based rehabilitation, made it rich, made it what it is today. But there are certain things which are still required to be done, and the consultation is, today's consultation is mainly on that. So without further ado, I would request Venki to come in.
Quality life of persons with disabilities in sometimes difficult circumstances, and we acknowledge this to ourselves. And we also, at this moment in time, record our gratitude for missions of WHO and its tireless effort to improve quality rehabilitation services and to ensure that everyone gets rehabilitation everywhere that is of high standard. We sign up to this vision. However, we should not lose the wood for the peace, meaning that we should ensure that the resolution that being going discussed and adopted in the next 2 years are fit for purpose and reach rehabilitation services to persons with disabilities living in poverty. Most of you know that the two health resolutions that are in the pipeline. One is on attaining the standard of health for persons with disabilities, which has been passed Executive Board WHO in January 2021, which will be adopted in the World Health Assembly in 2021, in May 2021. WHO and our member state stakeholders are also proposing a resolution on rehabilitation for all in 2022. While these two resolutions are needed in order to increase political will and investment in habilitation and rehabilitation services, we need to recognize the absence of CBR in these two resolutions is conspicuous. CBR Global Network and Indian Forum Rehabilitation Forum has been intervening with the first draft of the resolution and made a number of recommendations by sending appeals, petitions to permissions in Geneva from different countries in the world and different regions, requesting them to include CBR and other recommendations. The outcome is that in the current draft, you find inclusion of non-discrimination, access to rehabilitation, affordability, inclusion of persons with disabilities in universal care. Still, we don't need CBR. All of us know that CBR was initiated by WHO in 1989 and in practice in more than 100 countries, reaching millions of persons with disabilities. Sorry, I'm trying to read this bail. The current context makes CBR inclusion all the more important. All of us know that more than 150 million people are going back into abject poverty and acute hunger. Economies are shrinking at a rate unparalleled in recent times. Estimated that the world has lost more because of the pandemic, and because of the pandemic, 150 million people are expected to go back into abject poverty and acute hunger. Economies are shrinking at a rate unparalleled in recent times. There's an estimate that says that we have lost more than $3 trillion because of the pandemic, if not more. And WHO own estimates that there's a shortage of doctors and nurses, leave alone specialist therapists and others. Just doctors and nurses to the tune of 20 million today all over the world. Therefore, organizations like World Bank and WHO's own major programs, like non-communicable diseases, have begun to adopt community-based and home-based services and transfer skill shifting, basically transferring skills, building capacity of local community workers to so that they can function effectively and deliver quality service to persons with disabilities and other persons in need of services. The purpose of our meeting is to understand what is the impact of the exclusion of CBR on the very people whom we are trying to provide services to, which is 80 million, 80% of disabled population who live in middle and low income countries. The second thing, we are here to decide what we can do to ensure that CBR is included in the current resolution on attaining the highest standard of health for persons with disabilities. In order to facilitate this discussion, CBR Global Network and the Indian Forum on Rehabilitation for All has produced a policy brief, which is still under review, but you have a copy of the executive summary. And from this executive summary, we will be presenting the ask and the recommendation sections only for discussion, additions, recommendations, clarification, and so on. The value of community has been recognized and their contribution from time immemorial. People have lived us in communities and valued each other, and their values are interdependence, mutual respect, resilience. And CBR belongs to one such practice, which has stood the test of time. As every methodology has scope of improvement, so does CBR. CBR values communities and their contributions, and it gives them the opportunity to become responsible citizens and fulfill their obligation as citizens, even if it be in the community. There are innumerable examples of thus being promoted. One of them is Small is Beautiful, Schumacher and Mahatma Gandhi. And for that matter, our current Prime Minister values are based in these great people values as well. His call for local for vocal. And it also is in keeping with the General Secretary, the UN General Secretary's ask recently: global action, people action, and community action. History will judge us on the outcome of our efforts to get CBR included in those two resolutions. Thank you very much.
I call upon Mr. Arman Ali, Executive Director of NCPDP.
Good afternoon, ladies and gentlemen. I am Arman Ali, the Executive Director of NCPDP. After Venki has spoken, I really do not have much to add on, and he has really covered and summed up the whole thing very well. But I would like to bring forth a few points in front of all of you, and some facts and some figures which I would like to state, which would be my opening remark. Globally, there's an estimate that shows that at least 1 in every 3 person in the world needs habilitation and rehabilitation at some point in the course of their illness or injury or disability. And all of you will agree that there is this undisputed link between poverty and disability. Poverty, and even extreme poverty, it is a reality in many parts of the world. And with CBR, which is cost effective and which is cost effective, and for those in rural and remote areas, CBR is not just the first option; it is sometimes the only real option available. I will refresh all of yours memory during the lockdown, during the COVID. We're still in the COVID times, but when it was at its peak, when you wanted to reach out to people to relief, your Delhi connection did not work, your Chennai connection did not work, your connections in the metro cities. No, if you had to reach out, you need to know the people in the community who were able to reach out to people who needed medicine, the people who needed ration, or if there was a need of any kind of a treatment, and so on. So that's one example I think we all will remember for a long time to come. And necessity, it is a necessity of sometimes having, as rightly pointed out by Venki about being vocal for local. It's sometimes it's a necessity. There's something having to act locally. It's because on account of health circumstances where travel becomes detrimental. And there are some situations where travel is impossible for reasons we saw during the lockdown, the COVID pandemic, and also due to the natural disaster, which are strikingly on the increase due to the climate change. And I would like to add one more last point is the Sustainable Development Goals 2030, which says leave no one behind. And it also pledges to ensure healthy lives and promote well-being for all at all ages. I would rest my case here, and for all these reasons, that it is important that the World Health Assembly resolution on attaining highest standard of health for persons with disabilities and WHO resolutions on habilitation and rehabilitation should have a central emphasis on the role of CBR. I think that's one of the only way ahead of us. With this, I would like to end my opening remarks here. Thank you so much, Akhil. Over to you.
Thank you, Arman. Thank you for bringing on that point on leave no one behind. It is important, and it is all it ties up with CBR very well. So thank you very much for bringing it on.